Welcome, everybody. We're so happy to have you here tonight for our panelist discussion webinar on exploring Westport's relationship with alcohol. My name is Margaret Watt, and I am the Prevention Director at Positive Directions. I'm part of the Westport Prevention Coalition, and we decided to put this event together tonight in honor of Alcohol Awareness Month, which started last week on April 1st. So let me just say a little bit about who the Westport Prevention Coalition is before we introduce all of our panelists. We are a community-based coalition, so that means we're open to anyone interested in our mission, which is to prevent substance misuse in Westport across the lifespan through educational and environmental initiatives. Some of the things we've done here in town include conducting a youth survey every couple of years, our liquor stickers campaign, which you may have seen in local package stores, annual legislative forums to affect and inform policies at the state level, environmental scans at local smoke shops, which have led to statewide action by the Attorney General. And this work is not possible without stakeholders from throughout our community bringing different perspectives together, which is what tonight's discussion is also going to be. So we do welcome anyone to join us. And tonight's panelists, I'm going to show a list here. You'll hear them introduce themselves in just a minute. But I want to say that the reason we chose this topic tonight is that in our Prevention Coalition, we talk a lot about alcohol in the Westport community. Alcohol is prevalent everywhere. Nationally, we know that about a third of people don't drink. About a third of people drink at probably a level that may be high risk, and a third of people drink at sort of lower risk levels. And Westport, a lot of people have commented that alcohol is kind of at the source of most gatherings. It's not necessarily unusual, but there are cultural factors in our town that we want to explore tonight. And I'm going to just show two quick slides from our youth survey that we did last year around this time that show that in Westport, our youth are drinking alcohol. Our seventh graders are drinking, 7% of them are drinking. That's not, that's not insignificant. 1 in 10, 12 or 13-year-olds. But it is more than in other surrounding communities. Similarly, at the high school level, Westport youth in our survey are drinking at higher levels than many neighboring communities. It's still only about 1 in 4 youth that are currently drinking, which is defined as drinking in the past month prior to the survey. And that level is a lot lower than in the past. So those of us who grew up anywhere we grew up, kids today are drinking less, but they're still drinking more in Westport. So that's just one of the topics we want to explore, right? Good or bad, what are the factors? And not just youth, but across the lifespan. So I'm going to turn it over to one of our Westport leadership team members, Nat Smitteval, who's our moderator for tonight, to take it away with introductions.
Hey there, thank you, Margaret, and thank you to all the panelists. I am Nat Smitteval. I grew up in Westport, so I guess that's kind of the demographic that I represent tonight. I didn't think I would ever move back to Westport, but here I am for the awesome schools, raising my family, my 2 sons. I am a recovering PTA president, and so I got really involved with just youth and education, and I happened to stumble upon Westport Prevention Coalition during in my professional work. So professionally, I work in educational consulting, and I had heard that that WPC Westport, that Positive Directions more specifically, was doing QPR training for all of the juniors at Staples High School, and in curriculum design, which is something that I do. I wanted to find out more about that, and so I got kind of looped in with Westport Prevention Coalition, and for me, it's been, I think, the best parenting kind of resource that I can think of in town. It's free. It's an incredible group of people. I work in education, and there's a lot of things that that I went to school for. I'm expert and spend a lot of time in like DEI training and things like that. But in this realm and in Westport Prevention Coalition and the work that they do, I am in no means an expert. So I feel uncomfortable being on, the quote unquote leadership board. I am so much of a learner, and I'm always humbled, and I always walk away from the meetings with just something else that I didn't already know that I felt like, oh man, I should have known that. And so I think a lot of that stuff will come out. I'll use my ignorance as like a platform for tonight's conversation. But if anyone's listening in, the recording of this, and you're looking for just ways to become a better parent, ways to really kind of build your parenting acumen, I think that this is one of the best resources that we have in our community. And I feel almost guilty that more folks don't know about it. So that's me. And if the rest of the panelists want to kind of go down and introduce themselves, they are much more of experts than I am. I can assure you that.
Do you want to just call people out
Yeah.
around the circle,
So,
Nat? And I guess
right.
everyone talk to us about your personal and professional connections to Westport in this topic.
Yeah. So Kevin's right next to me, so I'll go in the Brady Bunch square. So go ahead, Kevin.
Thanks, Nat. And Nat, you are a tremendous resource for Westport, and a great addition to the Prevention Coalition. We're lucky that you did stumble upon us. My name is Kevin Godburn. I'm the Youth Services Program Director for Westport. I've been with Westport. I didn't grow up here. I grew up in Connecticut, but further upstate in the middle of the state. But I have worked for the town of Westport for almost 24 years. It'll be 24 in July. Starting right here at Tokay Hall, which is our teen center behind me, which was created to be a safe, substance-free space for kids here in town. Over the years, I've kind of taken on more roles within the youth services department, working for the Department of Human Services and their Youth Service Bureau. So now I also work on coordinating Westport Together, part of the leadership team for the Westport Prevention Coalition. I also staff our Westport Youth Commission, still work on some of the stuff here at Tokay Hall, and then also handle all of our diversion cases. So our Juvenile Review Board, which is our balance and restorative justice program, and our family with service needs referrals to our department. I'm also a parent myself. I have an 8th grader and I have a 3rd grader. So it's been an interesting journey, for me doing this work, as I was fresh out of college, and now doing it as a parent, and just kind of the different, perspectives that it's ushered in, and being able to look through that lens, I think is really it's been really beneficial to be in this work, as a parent, and to be able to kind of communicate and share some of my experiences. And yeah, I think that's a little bit about me.
Rennie, do you want to go next, please?
Sure. Good evening, everybody. My name is Rennie Affamato. I am the Recovery Outreach Manager for Progressive Institute, which is an IOP in Shelton, Connecticut, and we service the lower Fairfield area, all the way up to New Haven, and actually all corners of Connecticut, because we can do things virtually. But we're here to help out, people who have issues with or struggling with mental illness and substance use disorder. I'm also a recovery coach, and I'm a person in long-term recovery as well. My ties to the community is I actually live in Fairfield, but I, do work in Westport. I work with the coalition. I'm part of the coalition there. And I like to try to bring my experience. I've worked in the field for about 9 years now, both on inpatient and in outpatient. And having 2 children myself as well as a parent, I have a 9-year-old daughter and a junior in high school son, who deal with and struggle with the ins and outs of school and what goes on a daily basis with alcohol in the community and drugs in the community. So I like to try to bring as much information as I can to them, to students, to be a voice of a parent, a voice of person in long-term recovery, and somebody who's out there to try and help people to get in recovery and stay there, whatever that means for them. So that's why I'm here. Thank you.
And I jump in for a sec, Rennie, that was great. And you used the term IOP. So for anyone wondering, IOP is an intensive outpatient program.
Mm.
And also that reminded me that Nat mentioned QPR and all of our heads were shaking. Yes, we do QPR trainings in the schools and for the community, but QPR is Question, Persuade, Refer, which is a suicide prevention training. So
Okay.
alphabet soup.
Well, Margaret, thank you so much for, yeah, we often use acronyms. Do you want to go ahead and introduce yourself as well? Because you're going to be presenting a lot of you're going to be kind of,
I'll be jumping in with the factoids,
yeah,
right?
right. So
All right.
people have to know who
So-
you are. Yeah.
Okay, so thanks. I'm Margaret Watt. I'm, like I said, I'm the prevention director at Positive Directions, the Center for Prevention and Counseling. We are a nonprofit located right here in Westport doing community-based prevention, awareness, and community change. And that's my division. And then on the counseling side, we provide outpatient counseling for mental health and substance use issues. We also offer a lot of support groups, recovery supports, et cetera. I've been on the leadership team here for Westport for the last, I think, 5 years. Positive Directions is the designated agency running the Prevention Coalition for Westport. We get funding from DEMIS, which is the state, and from the town's Human Services Division. And my background is mental health, education, public health, all of this together. I'm also a parent. I've managed to get my kids through high school and they're now college age. Neither of them has reached the stage where we can yet say that their brains are fully developed, because we now know, right, that boys' brains keep developing until age 27 and girls until 25, and mine are not 25 yet. So work in progress, but we managed to graduate, and that's another lens that I bring to this work.
Mm,
Thanks,
thank
Nat.
you. Samantha, do you want to go next?
Yes. So, hello, I'm Samantha Sandrew. I've lived in Westport my entire life, and so I'm a senior this year at Staples. I went through elementary school and middle school here. I went to Saugatuck and I went to Bedford, and now I've done 4 years at Staples. I am one of the co-presidents of Teen Awareness Group, which is a group that works to provide mental health and substance abuse support to students in the community. We do events such as like Get Real Day, which is like a little assembly and a fair that like students can go to, and we have a speaker that either has experience with substance abuse or runs some kind of organization that surrounds mental health or substance abuse. And we also do like other community events like that. So I guess I've lived here my whole life. I know the student body and I know pretty much everyone at Staples, so that's my experience.
Oh, thank
And
you.
when you say Get Real Day is like a little assembly, that is a big thing.
It's a big event. I don't want to downplay it. It's a big event. We have Get Real Day, and then I don't know if you guys have ever heard of Dodge a Cop. It's dodgeball with cops. It's like a community. We work with the Westport Prevention Coalition or Youth Commission, and which is what Kevin is involved in. And we just run community events. Dodge a Cop is a fundraiser that we do with the police every year. A dodgeball, just to foster, that connection between police and students.
It's awesome. Thank you. Vanessa, do you want to introduce yourself?
Sure. Good evening. I'm Vanessa Herda. I'm a family nurse practitioner, director of clinical services at Aspetuck Health District. The health district is the local public health department for Westport, Weston, and Easton. I'm honored to be on the Westport Prevention Coalition leadership team. Also a parent to kids in the Fairfield school system, 2nd and 4th grade. And like you, Nat, I feel like this is the best parenting resource around. So I also learn so much from this group. So thank everyone for that. One thing that we did last year at the health department is we did a community needs assessment. And this was a long, probably over a year long process. And it culminated in a meeting with all people from all different sectors of the community. And one thing that came up over and over this meeting was the tremendous pressure that it seemed like students, young people were in our community. And so I think there is a connection between that. And we talked mostly about academic pressure, sports pressure, just the pressure to succeed in all different facets. But I really felt and feel like there's a connection between the drinking culture, the pressure, et cetera. So the cultural discussion tonight, I think that's very unique that we're doing that. And I'm just really excited to hear what everyone has to say and hopefully bring it back through the health department to the community. So thank you.
Mary, would you like to introduce yourself?
Sure, thank you. I'm Mary Dobson. I'm delighted to be here, be a part of this tonight. So my current relationship with Westport is I own a Lift Wellness Group and Lift Well Health. Lift Wellness Group is an outpatient psychotherapy center with psychiatry, testing, counseling, family services. And Lift Well Health is an IOP, PHP here in town. We do mental health and disorders of over control, so OCD, trauma, depression, and anxiety, and eating disorders. And to sort of go back a little bit, I think that I've always been very interested in people's relationship with substances. My early work was doing school-based interventions for children who experience truancy as a result of substance use in the Stanford school system, and I'm school certified as well. And later I ran a residential program in Hamden for substance abuse, ages 10 to 18, for children who, almost an alternative for incarceration program for children who were really needing to get at the root of what drove their criminal behaviors. From a sort of a family-based intervention in a residential facility. But my background has been largely in residential management and overseeing residential centers. I shifted over to running IOP, partial hospitalization programs and outpatient later on in my career. And I'm looking forward to a good conversation about this. So thanks for having me.
No, thank you. And then,
And Mary, you've got your own kids too, right? That are what ages?
Yeah, I forgot to mention I'm a mom of an 8 and 11, so we're not quite there yet. And I did grow up locally, so I'm a Fairfield native. We live nearby still, and we've yet to encounter this with our own kids, but I'm very interested in always learning and talking about to other parents about what they're doing and how they're managing these things.
it's awesome. And last and certainly not least, I'm so honored to be on a panel with Brian. So Brian, please introduce yourself.
Thanks, Nate. Brian McGungle. I'm a Westport resident. We have lived here, my husband and I, for 8 years now. We have a 6-year-old and a 2-year-old, so a kindergartner and a home baby. I also founded Westport Pride in 2021 as an organization to support our LGBTQ community here in Westport. We've done several initiatives with the schools and with other community groups in town. I also serve on the Downtown Plan Implementation Committee and the library's Common Ground Initiative. I'm also in long-term recovery and am also in the process of becoming a priest with the Episcopal Church. So a couple of things. Happy to be here.
All right. So now that we've met all of our panelists, I'd love to start it off with just examining what our relationship, what role does alcohol play? Samantha, I'd love to start with you because tag is something that I didn't have when I'm a class of 94 grad at Staples. So that was the old building. Staples was like literally, I think there was 200 kids in my graduating class. It's a very, very different place. But Westport was still Westport. And I feel like based on a lot of our conversations that there was a lot more pressure for students at that time to drink. I know I certainly felt it. Can you talk more about like your role and tag? And then I'd love, to hear everyone and what their thoughts of like the intersection of Westport specifically and alcohol.
So tag does not advocate for complete zero tolerance. We recognize that in this day and age, there's a lot of accessibility to different kinds of substances, especially with like the legalization of marijuana and other substances. And so we really emphasize on balance. And so we do, for homecoming, a lot of students have a reputation for drinking before football games. And so we advocate excuse me, I'm blanking on the name, but take the pledge before homecoming that you drink, either you don't drink at all or you drink very responsible. Remember the game, yes. Remember the game. To remember to be responsible at the football game. That's what we emphasize. We're not zero tolerance. We do offer support rather than punishment for engaging in substances, and that's what we focus on, because we don't want our the students to feel like they can't come to resources because they feel like they're going to be punished for it.
That's really powerful. I know that in one of the meetings, because Margaret and Kevin, you both work with TAG, and I remember some data where one of the meetings, Margaret did a kind of a poll of TAG students, and one of the biggest behavior modification techniques was, or one of the things that came out within that poll, and it was a small number, but that students or TAG students specifically were worried about getting in trouble with the police. Right. But we know in kind of conversations, and Fodi's been to some of our meetings and he's been amazing, is he also is not, I don't want to speak for him, our police chief, but I know that he's not looking to arrest kids. He's more looking to keep kids safe. He also kind of let us know about this Uber home kind of thing, which didn't exist obviously when I was growing up.
Yeah, big Uber culture and that kind of thing.
Yeah.
That's more positive. Drunk driving is not really something that TAG focuses on anymore, just because of like Uber is very accessible.
That was such a huge blind spot for me. I don't know, Mary and Vanessa, other and even Brian. Hopefully we're not having to worry about this now. And I think we're all parents, Rennie as well, but that was such a big blind spot for me, in that, wow, like I remember going, I actually didn't go to parties because I didn't want to feel the pressure to drink. I drank with my friends, kind of just alone in smaller groups. But I remember there were parties where parents took the keys, and they tried to keep, the parents would keep the kids safe and make sure that no one would leave, and you would sleep over at friends' homes and things like that. So it was kind of like that. And so for me, it was an aha moment of, wow, like now with teen Uber accounts, like Mary is this something that the other parents, I'm just looking at Mary, but I know we're all parents, is this something that you all were aware of, and what are your feelings about this Uber home and what we're talking about now?
Yeah, it is. It's really interesting. I mean, we certainly never had we didn't have anything like that when I was growing up. But I think that the beauty of kind of acknowledging the reality, which is that a percentage of kids are going to drink, and we're not going to convince children not to try alcohol. But the acknowledgement that taking anything too far is a bad idea. And, if you're going to a football game, you want to remember the game. I love the concept of that. I wasn't aware that, TAG took that position and was able to kind of acknowledge that you're meeting people where they're at. And there are going to be kids that also choose to abstain. And that's wonderful. But for the subsection of kids that are going to choose to drink, sort of meeting them where they're at and saying, let's get home safely. And that's a huge thing, because I think, at least for me growing up and years and years following, I can't tell you how many fatal drunk driving accidents that I was aware of peers. And then when I became a psychotherapist of patients and patients' friends, it's been sort of this long-standing, horrific thing that, people get in cars and it's terribly dangerous. So I think that is something that's very positive.
Vanessa, I know that Aspetuck Health District, I know that you kind of pulled out some data for past Westport Prevention Coalition meetings that kind of looked more closely at the number of youth that were, kind of in EMT services. And do you want to talk a little bit about that? What have you seen? Have we seen anything different over the years?
I haven't compared to I think what we were gonna do next for one of our future meetings was maybe compare pre-pandemic. Is that what we talked about doing, Kevin?
Yeah, I think so.
Yeah. So the numbers were small. I would say that the numbers of adolescents were certainly small that would show up in the emergency room related to alcohol, directly related, right? And the adults were actually sort of the biggest number, if I recall. I don't have the numbers in front of me, but I think we don't always, we spend a lot of time here talking about children, but actually we probably have a lot more that we could do with the adult population. So I think that is the thing, that was the takeaway from the numbers, was actually that the adult population was the population that was servicing in the emergency room. And perhaps the suicide numbers were maybe higher in sort of the adolescent or, attempted suicide. So of course that could be related to substance too. It's hard to, say. We're just looking at pure numbers. I'm surprised. I too, Mary, didn't know that was sort of the approach that TAG took. And I'm just curious, Margaret, what message, what you think the message would be. Like, that's a great approach in some ways. We certainly don't want people. I think that's the thing parents always worry about the most, right? Is and some sort of accident. But what would we say sort of in response to that? Like, is drinking a little bit okay? I think maybe that's the next place this conversation should go, right?
I think that's such a great point, Vanessa, because it's, it's actually, I think, a good example of the Westport culture, right? So first of all, I wanted to thank you for bringing up the data on adults, right? I think in pretty much all communities, it's actually adult drinkers who are ending up in the accidents and in the ER more often. But then you think about, okay, so if they're drinking at that level, what is also the message they're sending to kids? If kids see their parents come home and every day it's like, I need a drink, or this is how I'm coping with my stress, that's a message, right? Mm-hmm. But to your specific question, it is interesting. I mean, prevention science tells us that, like, the majority, and our data locally, nationally, state data, everything says the majority of students don't drink or engage in substance use anymore, right? The vast majority. So, so the norm is non-substance use. And so what we're supposed to do from all the science is treat any use of substance as a red flag. And then to Sam's point, I think people have moved away from the punitive approach, right? It's like restorative. You work on what is the policy response in a school system. You catch someone using something, okay, let's provide some counseling. Let's provide some psychoeducation. What do you know about why this drug is bad for you? Do you know what marijuana does to the brain? Do you know what alcohol, do you know about alcohol being connected to all these forms of cancer? And then, as Mary pointed out, there's a small number who are using, and you want them to have kind of harm reduction approaches and resources. But I do think it's interesting that in Westport, the approach of the group most visibly associated with substance misuse prevention, doesn't say we are ourselves like here for abstinence, or we're role models for not using and so forth, because in other communities, that's what the youth folks do who are engaged in this work. And still everyone works along a continuum. If someone's using, if someone needs help, let's get them help. So I think it just does go to what is the culture in our town. And I think the question that gives me to bring back to both Sam and the TAG members who are watching, and I really appreciate that both Rennie and Brian, stated that they're in long-term recovery. Question I always have is, what's it like to not drink in Westport? Because I've noticed when I've talked to students, a number of students have said to me, I don't drink, so I don't go to parties. And Nat, you even said that earlier too, and you and I talked about that. Is it that the majority who don't drink as adults or kids feel excluded from the party culture? Or do you have to have like separate little gatherings over here? I think that's an interesting question, not just for the kids. Let me ask Brian, because I just saw his eyebrows go up. I'd love to hear from Brian.
Um,
Bless you.
yeah, thank you. For me, it's I think it's interesting to observe. I find that, you know, a lot of people drink in this community, and events tend to revolve around alcohol, from fundraisers to family gatherings, going out to a restaurant with another couple. It's a component. I'm at a point in my life where I don't feel the urge to for today use alcohol or drugs, but I find at least the people who I feel may have an issue are the ones who um, they'll ask you the question, why don't you drink? What's going on? Why? What? It's almost to justify their own use of alcohol, and I found some people are uncomfortable with people who don't drink, as much as, you know, I might at times feel uncomfortable in a situation where alcohol is being served. But, you know, I've learned coping strategies over time that feel effective for me. And there's always, you can always say there's a, you know, I'm not drinking today. You know, I'm not having, you know, I don't feel well, or whatever it is. You know, it's, but it is surprising to see. And I grew up in a town called Rye, New York, which is down in Westchester, you know, about 30 minutes south of here, and it's a very similar drinking culture there. And you know, I remember in high school being part of similar kinds of panel discussions where, you know, people can't solve it. And so you know, it's interesting to hear as a parent that it's a challenge here as well.
Yeah,
I'm wondering, Mary, you know, this has come up before. Sorry, I don't know if it was Mary that was just started to talk, but Margaret, we've talked about this before, people who've lived somewhere else and then come into town. I don't know if anyone here is on, you know, in that situation, but it would be interesting to hear somebody's perspective if they were.
I
Yeah.
can jump in here real quick if you want. Oh, Mary, you go ahead.
No, please.
So I am a transplant myself. I'm originally from New York City by way of Florida. So my family and I moved up to the Fairfield area back in 2019. And I think the thing that we need to really look at is the normalization of drinking in adults and what the influence is on our children and on the community as a whole. You know, if daddy comes home and Johnny sees daddy having an after work drink, you know, to kind of chill out, that's sending a message to our kids that it's okay. Like this is the norm, right? And, you know, myself being in long-term recovery, going into situations where there is alcohol, I have to, you know, keep my defenses up because it is uncomfortable at times. It does get to a point in those situations where it's time to leave. Like, I don't need to be a part of the ruckus that goes on, you know, after the 10th hour or whatever. So it's really important to understand that and to bring that home and convey that and educate our children on the effects, like you were saying, Margaret, and what happens when it goes too far and what happens. And I love the fact, I love the Uber, you know, that's fantastic. Now it's sort of a Band-Aid in a way. It's a safe Band-Aid for our children to get home if they are using and experimenting with their friends. And I know that there's a lot of peer pressure out there. I have a 16-year-old too. And you know, he goes out with his friends and I know that he's being asked to drink. And has he tried it? I'm not going to speak for him. You know, he tells me, he's very open with me, and he knows who I am. He's been with me my entire journey. So he understands the effects and what can happen in the future if he's unchecked, basically. So I think it's really important to find out, you know, to really talk about what's going on at home, what's going on in the community, and how normalized is it, you know, and is it excess? Are they seeing the excess of it too? Because
Yeah.
I'm sure we'll talk about that a little bit later about events and things like that. So
Thank
Yeah.
you.
And Vanessa, yeah, no, Mary, go.
I was just going to add, I appreciate that, Rennie. And, you know, I was thinking when we were talking about sort of the general culture, I have seen a shift over, and I'm not sure if it's really reflected in the data that, you know, we just reviewed. But anecdotally, I think at least in my office with patients and in my own social life, I've really seen a shift over, I would say, the past 2 years towards a pretty substantial reduction in drinking from adults. And I think a lot of that, I think most adults kind of reported that they felt uncomfortable with the amount they were drinking during COVID and after the pandemic. And then the information that came out in January that there's really no safe amount of alcohol. All of that seems to have culminated in this general reduction in drinking. I think a lot of adults sort of were going home from work and having a glass of wine on a nightly basis post-pandemic and had ritualized themselves to that behavior and normalized it. And there's just been an examination of that behavior. I've seen, you know, there was an article about it that I contributed to in, I think it was January. There was a Sober Curious article in one of the Westport magazines. And, you know, I just actually got back from a 4-day trip with a few couples. I don't think anyone had more than one drink per, you know, a night, if that, for the whole time that we were away. And it's just interesting, you know, because there has been this big shift. I don't know if the data sort of shares that, and I'd be interested to hear if it did. But the other thing that I was thinking in terms of, you know, kids drinking, we know that every year you can keep your kid from trying alcohol, they're less likely to develop a problem with alcohol, you know, and I sort of think about alcohol use as it's like that harm reduction model of, you know, how long can you possibly wait? How long can you possibly keep your child from trying alcohol and kind of bringing alcohol into their lives? Because, you know, if they start drinking at 11, they're statistically very likely to have to develop alcoholism. Whereas if they start drinking at, you know, 19 or 20, they're that much less likely. And if they start drinking at 22, they're even less likely to develop a problem with alcohol. So it's almost like the brain sort of develops around the presence or absence of this substance. And if you can, you know, kind of get the brain to develop as long as possible without the presence of the substance, it's overwhelmingly positive for the psychology of the kid. But when there are kids who are drinking and, you know, they're drinking, whether they're freshmen in high school or juniors in high school, they're definitely watching their parents. They're definitely getting their social norms from their parents' behavior. You know, do parents sort of party on Friday and Saturday night? What do parents do for fun? What's modeled to them as being fun? Also, if their parents are drinking on Friday and Saturday night, they're probably not providing their kids with alcohol-free opportunities for fun, you know, because you can't possibly be saying, hey, let's head up and do this fun activity with you and a bunch of your friends if you're partying with your friends. So there may not be a lot of carving out of alcohol-free opportunities for their kids if they're imbibing on a high level. But I always think about with kids, like, what's the motivation? Are they motivated by fitting in? Are they motivated by acting out? Is it a red flag, like they're in personal pain? Or are they trying to look cool? You know, what exactly is driving it? And
Curiosity.
yeah, and what's driving it also tells a story about what their risk factor could be, you know, because if they're being driven by, you know, mom and dad are getting a divorce and I'm crying out for help, that person is more likely to end up in the hospital, you know, or more likely because they're really trying to kind of garner people around them that are concerned and you know, and they're communicating something. So I think the motivation is a big factor too, and kind of looking at that motivation.
And that, Mary, that totally applies to all of us, right? Not just kids. It's like why with kids, we want to like check in on all their mental health and substance use and like why, and what does that tell us that they need? But adults too, right? I mean, you know, I also feel like I want to make clear that we're not trying to demonize people who have a drink after work, right? Like most of us have done that. Maybe we do it regularly, but it's that whole level. If you're an adult, like how much, why, what, as you said, what could you be doing instead? And I think a good question, again, coming back to like how predominant is alcohol in our culture is, if you did your normal social things with your normal friends, but you didn't have alcohol, would everyone be like, I'm not coming out, I'm not going to play because that doesn't sound like fun. But sorry, Sam, you started at like,
Yeah, Sam.
sorry.
Yeah, to not just to the motivation, not to be any specific here, it's obviously very personal as to why someone chooses to partake in substances. But at Staples, especially, we have a very strong work hard, play hard mentality. And because these students feel so pressured and the classroom is so intense and that drive to succeed, I think a lot of students let off steam by partaking in some kind of substance or alcohol on the weekends. And that's just my perspective. In general, it's obviously very personal, like family issues and that kind of thing. But I do see like that kind of work hard, play hard attitude.
Sam, can I ask you, do you feel like to the extent that you know about parties that are those kind of play hard parties on weekends, if most people are using substances and some kids don't want to drink, are they going to feel like there's something there for them? Or are they going to not be invited? Are they going to be invited and not go because they opt themselves out? Or if they go, are they going to be like, it's not fun to be the only person here who's not kind of altered?
Yeah, I mean, my personal experience is just that, what was I gonna say? Is that people don't usually like it's not very stereotypical peer pressure like put like what we see in those 90s like commercial like
Yeah.
just say no. It's not that. I think it's more of an internal peer pressure as people feel excluded or maybe left out if other people or the majority are drinking and you're not. That's what I personally think it is. I don't think it's necessarily like you're not allowed into this party if you're not drunk. I think it's more so like they just feel more social anxiety if they don't fit in with everyone else.
Thanks.
There was so much said that I want to unpack. For the parents that will be listening to this, that may be listening now. And Mary, you said some really important things about the conclusive data, right? And one of the things that I learned along the way with WPC, and this is something that, Samantha could probably think about and talk to, is like, I thought that I was, based on my experience growing up in Westport, I thought that in raising my own kids, I thought, okay, I need to have them be ready for college. When they go off to college, they need to know how to kind of make decisions about alcohol, and whether it's not to say no, whether it's to like how to control their alcohol, how to know when they've had enough. And so in my mind, it was always like, I'm gonna have them try it, like when they're in high school, and maybe I'll be around. And I don't know if Samantha, like if you've heard that, if like parents are comfortable with their kids trying it so that they feel more ready for college. But then what I learned, and what Mary, you just emphasized, was that the data is conclusive, and that when you do that, you're not, like, the longer you can wait. And so, the better you are prepared for college. And I think looking back, I mean, I thought I was prepared, in trying it with my small group of friends and like kind of a trusted environment. But then I was not prepared when I got to college, in a very, very bad way. I was not prepared. And so I wanted my kids to be prepared. So I love the fact that you said that, and I hope we can capture that and produce a soundbite out of that, because I know Margaret has said that as well, is like the data is really conclusive in terms of best practices of how to talk about kids, how to talk to alcohol, and how to, get them ready for it at certain ages. I know Positive Directions has something on their website that has like how to talk about it with your elementary school student, how to talk about it with your middle school student, how to talk about it with your high school student. So Samantha, have you heard of, that being a thing where parents are feeling like they are going to let their kids drink so that they're ready for college? Or is that something that is foreign right now?
I think it's more of a parent, like obviously it's a very personal parent's
Yeah.
choice. I have like we do have like some more European parents and families in the school system, and so I think that's more of a practice, like a European practice, like just drinking and around the family and that sort of thing. I have, I think that as you get to be a senior in high school, I think more parents are okay with maybe when they're traveling, they let their child have a drink or two at a restaurant like with them. Again, that's a very personal choice. I think it's more of the issue. Parents become more nervous when, like, say their child wants to host a party at their house, and then it's like not their children drinking, and that's when it's like, okay, it's like it's very again like you're my child and I'm watching over you. But when it extends to other people, they don't really want to be responsible, which I understand, obviously.
Yeah, you bring up a great point, and we don't really have someone that I know of that can address it, but I wonder what alcohol and binge drinking look like in the UK, right? Where it's not as taboo and because yeah, you said it, like when the drinking age is, and it's not as taboo for a high school student or a university student to be drinking. I think what I've heard is that they don't struggle with it as much as American college students do. And so that would be interesting to kind of look at and to see if we can find best practices within, examining those two sets of data.
There is some data though on comparing European drinking in teens and American, because this does come up, right? Because people are like, oh, what's the cultural, what's the cultural expectation? And I don't think, like to Sam's point, I don't think it's looking at really what's happening within the family. Like, do you have a glass of wine with dinner because that's what you do and you're French or whatever. But the party culture, drinking at parties in Europe is shown to be very similar to here. Kids who start drinking in the high school years tend to be more problematic drinkers when they graduate and go on to college. They drink more frequently. They're more likely to binge drink. They're more likely to have a problem with it. So really that kind of brain-based approach, which is consistent, doesn't sort of matter what your cultural expectations are. And I was thinking a statistic or a factoid that's probably worth sharing is that 90%, research says 90% of people who develop some kind of substance use disorder started using their substance before the age of 18. And so I forget who said it, I think maybe it was Vanessa, or I guess it was Mary, the longer anyone waits to start using any substance, the more they're letting their brain develop. And they're not hard coding the pathway to addiction into that developing teen brain.
I always thought that when we would go to Europe growing up, we'd see our friends, our peers. I also thought, because back then, and maybe that's still the case, but I also thought that it was perhaps not as problematic for Europeans in the college years. But friends of ours who are from Europe say that they have very similar kind of issues there that we have here. The school system isn't necessarily exactly parallel to ours, so it may come out at different times, but there's generally like a real rebellious time and use of alcohol and expression of freedom that happens. I think the other piece is also that we didn't mention when kids start using alcohol at between the ages of say 13 and 18, they are that much more likely to experiment with drugs when they age, because they sort of are bored of alcohol after a certain point and are more interested in experimenting with bringing in other substances. That's a piece. I know the focus is on alcohol, but it's if you start drinking very early, there's a probability that after 3 or 4 years of that, you might be more curious about trying some other substances.
One of the other things that I wanted to unpack was when Brian and Rennie were talking about, what right now it's spring is just starting to come around. I know today was cold and rainy, but with gala season coming up, and I know I have a few galas coming up, one for A Better Chance of Westport, a wonderful organization, and students are at that gala, right? Like we're celebrating the two graduating seniors, and it's a really special time. And then I have one for where my kids went to preschool, before they entered Saugatuck, and the director is retiring, and I have been an MC at those, at the latter of those events, and I remember specifically, that alcohol is flowing at those events. And it wasn't until I think Margaret and I figured out, it was this past summer where I figured out, like, I had the aha moment of, I do so much with DEI and inclusion and making people feel included, and the sense of belonging. And it was such a blind spot for me that me drinking so much or being a part of that culture was not being inclusive of everyone in our community. And so, Brian and Rennie, I really appreciate you guys talking about that. And I know that I'm not going to say I'm not going to drink at those events, but I know I'm going to be a lot more thoughtful about that. And I know, like, from a planning perspective, right, like the alcohol helps you raise money, and the gala is supposed to raise money and things like that. So in examining our culture, one of the other things that came up was how much alcohol parents in Westport drink during Halloween. Right. And so, and I know this came about because we're lucky to have people that work in Westport, but don't necessarily live in Westport, right? And in Westport Prevention Coalition. And so does anyone want to talk about Halloween or any other kind of, I guess, ceremonial drinking times that we feel are just kind of the center of gravity and regular, but then when you're from an outside perspective, you're like, wow, like, this is really alarming, because I didn't even realize that it was such a big deal. I just thought that was
normal.
I didn't think about it.
I can mention just that came up, I think, the first time when I was talking to the school climate committee at Bedford. I think that's where it was, and or Coleytown, and some parents brought it up. And I mean, I grew up in Darien, and it's not a very different culture, but it's different enough that I was like, wait, what? Parents bring booze with them when they take their kids trick-or-treating? And a bunch of folks went, yeah. And then they said, and people answer the door and offer the parents a beer while they're giving the kids candy. So we ended up really talking about this and going, where else does this happen? And we did a little poll of our members, right, Nat? And a couple people said, yeah, that might happen in my community, but most people we didn't have a huge number of responses, right? But that's such a good example of something that if you grew up here, maybe feels normal. And obviously it's not going to just be Westport, but it's an eye opener if you think that parents drink, if you think parents go taking little kids trick-or-treating, and you think that them drinking is normal, and then you realize, oh, maybe it's not normal everywhere. That is an interesting aspect of the culture that says alcohol needs to be a part of even things I do with my little kids, right? That's just interesting, which was something Vanessa was asking before. Rennie, I saw you start to.
Yeah, I mean, Margaret, you and I had talked about this early on when we started talking about this panel, and it's amazing, trick-or-treating with your kids and getting asked if you want Jello shots, while your kids are getting candy. And that's something that's real. And I see, parents driving around on golf carts, not in the right state of mind, and that's not a message that I want my kids to see, but that's the reality of it. And that's unfortunate. But, I don't want to point fingers at people, because I used to do things like that too. It wasn't like I was this guy with a halo over my head my entire life. I am in long-term recovery. There was a time before I got into recovery, so I understand it, but it's definitely not something I would like to portray to my kids today. The other thing that we're talking about different events and things, and you talked about galas, and to auction off like wine or champagne or something in an auction, that's another message that we're sending people, that it's okay to normalize alcohol. And I'm not saying alcohol is a bad thing, it's not, but it's the misuse of alcohol that's the bad thing, right? And what leads to the things that happen when we drink excessively. And then the other thing I can't not think about, sporting events, our kids going to lacrosse games and soccer games and football games, and sitting in the stands with parents with tumblers of vodka. It's like, what are we doing here? Can we
Well,
see?
and then who's driving those kids home after that game?
Exactly. So it's a really, it comes down to a safety hazard. It's a safety concern for the families, for the people on the road, for the people who are going to these games and hanging out. Tailgating in the parking lot before a high school event um, is another, message that we're sending our kids that it's okay. So yeah, I just thought I'd bring those up. Thanks.
Brian, what are you thinking as this part of the conversation goes on?
No, it's interesting. I think growing up in a town like Rye, New York, which is similar, there was a big football game, and every year the tailgating is more important than actually watching the game at times. And so to hear that, those things here, and I agree. I went to our first Halloween here a couple years ago, and our friends were like, "Come over for some pizza," but it was really like the guys were pounding beers before we had to go out, and so that was eye-opening for me. And going to parties where I hear that people are serving edible items that are intoxicating, that kids have access to these things at these types of parties is stuff I didn't expect. I think when I started to socialize more with adults here, and then just within my LGBTQ community, it's there's a lot higher incidence of these kinds of behaviors, and it's a normalized and almost expected behavior to drink, or being part of a group that has had minority stress is the term. Bars were the places you met people, and drinking was the way that you did that. And sobriety, trying to meet people, I remember it was like, let's go out for a drink. And I met my husband at a bar for our first date, and he's like, "What are you having?" "What, I'll get you another, what is that, a gin and tonic?" I'm like, "No, it's a seltzer." And I'm like, "I don't drink." He's like, "Why are we at a bar?" And I'm like, "I don't know. Like, that isn't that where you go, like, on a date with people? You want to have coffee?" Like, if I say that, it comes across weird. But just to throw some numbers out, because I was doing some research, and I think you've confirmed this, Margaret. In the general population, moderate to severe alcohol dependency is probably in the 5 to 10% range, and in the LGBTQ community, it's 20 to 25%. And the Trevor Project found that 56% of LGBTQ youth have used alcohol in the past year. Um, and so those are pretty alarming numbers. And if you were to look at the alcohol and drug use of those populations, methamphetamines, cocaine, heroin, all of them can be up to double the rate of our heterosexual brothers and sisters, so to speak. So, it's pretty alarming, and the culture has grown around that. And even with Westport Pride, when we try to do events, people want to have a meetup at the bar, and I'm like, oh, it's become the social lubricant of the queer community, unfortunately, and we're seeing in older adult men over 55 that the number one cause of death in gay men is methamphetamines, and so it's and using drugs and in alarming ways, and so it's a big problem, and it's and Westport is probably exacerbated more.
Our youth survey did show even that among the LGBTQ youth looked like they were using substances about twice as much as the general population rate. And yeah, and you pointed out the term minority stress, right? It's like our marginalized communities tend to use substances more in general. Like, so whatever age we are, like if we don't feel like we fit into the culture around us, then here's a self-medication kind of like coping social lubricant thing. The other piece of it though is I think when going back to teens, and we're not just talking about teens tonight, right? But the the nicotine industry that brought us all vapes when people stopped using cigarettes has all kinds of campaigns around vaping, nicotine pouches, et cetera, that are targeting LGBTQ youth in particular. They're also targeting youth generally because you want to capture a market young, right? But it's interesting. So I'll just like give kudos to the state of Connecticut where there's a sort of response called the True to You Coalition that's trying to produce marketing materials and messaging for LGBTQ youth. It's kind of like, don't let them hoodwink you, right? Like, you don't have to use substances just because they're pushing them on you. Like, recognize that they're targeting you.
Yeah. I know we're coming upon our 1 hour mark, and we want this to be kind of the catalyst for an ongoing conversation. I was curious before we left, Kevin, have you seen in your role kind of working at youth services, have you seen any differences over the years? And I know like one of the things that we would like to do with this video, with this get together, is have it as kind of a time capsule, right? And then in maybe 10 years time, maybe we won't be talking about, drinking heavily at Halloween, and maybe it will be something else, but it would just be very interesting to kind of keep this data. But Kevin, have you seen any changes in your role over the last, the years that you can speak to?
Yeah, absolutely. Great question. Yeah, and there are a couple points where I was going to jump in, but the conversation was just so good here. Yeah, so looking, from a kind of a big arc from when I started. So I started in Westport in 2001, and coming from a community where there wasn't as rich of an alcohol drinking culture as I found here, it was a little bit of a culture shock. As I think as Sam, mentioned earlier, there's that, work hard, play hard, hard partying, energy here. So it's been interesting to kind of see that path. We certainly, heard a lot about, the house parties, and it seemed to be more frequent, really early on. I still remember back in like 2005, before the state adopted their underage drinking ordinance or statute. There were a bunch of communities across the state who were considering underage drinking ordinances for their community to help curb that. I think at the time there were, maybe 40 towns across Connecticut who had jumped on board and passed ordinances to address it. Our youth commission looked into doing that for Westport and really ran into a lot of resistance. And we were kind of like, at that time, it was a little bit of an eye opener, like, whoa, we're like, it seemed like a no brainer that we would do something like this. And over the years, we've seen things, back in around like 2010, there was a big issue at one of the homecoming games at Staples where a bunch of kids had to go to the hospital due to intoxication. And there was a lot of community conversation around that. I will heap praise on TAG. They've done, just tremendous work over the years, addressing from the peer perspective and, talking about, curbing underage drinking and driving, certainly early on. And it's been neat to see the evolution of where TAG has gone. And Sam, I wrote down, I'm glad you mentioned it because, one of the things that I really appreciated that I've heard TAG say a couple of times, and you said at the Risk of Behavior Forum, was that the peer pressure is more of an internal peer pressure, that you just don't see that at parties. And I think that's, an important point. So I'm kind of going off in tangents now a little bit. But there does seem to be this shift, and I think I think it's come with, the work, the communication, the education, the number of resources there that are available to parents, just, about having these conversations, about learning what the statistics are, and where the risks are. There's so many more, I think, now available than there were 5, 10, 15, 20 years ago. So that's been a big change. And we don't hear about the like the raging house parties every weekend. Do they still happen? Sure, but it doesn't feel like it's the same volume that it was, 24 years ago, which I think is a positive. And I think nationally, as we kind of see more of like the sober curious movement. And, we've talked in the Prevention Coalition about, the non-alcoholic sections of package stores, liquor stores, like exploding. And just kind of the shift in new people, I think, coming into the town, and being able to have these conversations and kind of change some of that thinking and some of that culture. My hope is that we are kind of continuing that upswing of becoming healthier as for families, healthier for our kids, healthier as a community. And in that same kind of evolution conversation, I also appreciate kind of where TAG is gone, again, to praise the work that you're doing in kind of shifting, not so much of focusing strictly on the underage drinking and the substances, but also addressing mental health and the stresses and the challenges that kids are under, and some of those underlying reasons why kids may turn to substances. So like the work that you do with Get Real Day and the health and wellness fair is just tremendous. So I think we have a lot of things kind of working in our favor as a community. There's still work to do, and there will be work to do. And I don't think I'm alone in being concerned about what cannabis is kind of bringing along the pipeline, because I kind of feel like we're in some ways where we were with alcohol 15 years ago. So we're gonna have to do work and educating there. But it's going to start with the conversations, start with giving parents the resources to talk to kids. There was a note in the chat about the importance of having those conversations if there's a history of substance use and in the family. And yeah, absolutely, yes. And that's something that we've brought up at other forums, other discussions, other panels, and something that we try to communicate a lot. It's important to talk early, talk often, and especially if you have that in your kids' genetics and in your family history, to not to delay to talk about it as a family. So hopefully I kind of got to an answer to that question, but I short and sweet, I have seen quite a change from 24 years ago.
I love what Samantha had to say. I love hearing about TAG. I've only heard amazing things about TAG and their presence. I know, and I hope we're not ending on this note. And Margaret, I would count on you to kind of wrap everything together and kind of maybe maybe kind of stir the pot about future conversations as well. And if we want to do, we want to examine other drugs or other addictions and other mental health things that we intersect with in Westport. But I can say, in the prevention work that we're trying to do is really difficult because oftentimes you don't see, change is glacial. And I'm thankful that we have seen change, like from, your perspective, Kevin. I would say in the class of 94, which that's when I graduated from Staples, there is a lot of, when I think about my classmates and I think about some of the other kids that, that are within my graduation years, there's certainly a high percentage of alcohol or has been alcohol or drug addiction. There's percentages of, like, it's not just 1 or 2 or 3 or 4. It's higher than that in terms of the number of my classmates that have died by suicide. And most of them that I'm thinking of had some form of drug or alcohol addiction. So we don't see the effects of what we're doing right away, right? And it seems just normal to be doing this, but we, oftentimes, and of course, the work that we're doing is not just for our kids, but oftentimes I just want to, and again, and not in a judging way, right? Because you're going to see me kind of, at the galas and stuff, but just to be more thoughtful about what are some of the ceremonial things and what are some of the cultural things and what does it say to our kids and what does it set up our kids for? So I don't know, Margaret, if you want to give everyone a chance to say a sentence, or if you want to kind of wrap it up. I know we're running up on our time.
Yeah, I mean, I don't know. I'd love to What if we go around just everybody, if you can pass, but if you have like a final word to share about something that struck you tonight or what you see as a next step. Mary, you already put something in the chat about a possible next step. So why don't we just start with you? Like everybody get your 30 seconds in of what next? Or what did you take away from this?
Yeah, I think I said this in one of our prep meetings. I feel like if parents have tuned into this and they feel uh, challenged or changed by some of the data or the discussion, I just would encourage parents to not be afraid to talk to their kids about substance use and also to not feel like hypocrites because a lot of my patients have said to me that they feel uncomfortable talking to their children about their substance use based on their own substance use. So because they imbibe and because their kids see them imbibe socially, they don't feel like they have a leg to stand on when it comes to their kids' substance use. And I think regardless of parents' substance use, um, it's our obligation, our duty to really, ensure that uh, we can help our kids wait as long as possible to start using substances. The data that was presented tonight, and I think that it's not about mom and dad's behavior. It's although that's always a good thing to look at and talk about, but it's really important to kind of set that boundary with kids and be very clear about why they're different in that their brains are developing and growing and they're at a very different vulnerability should they start using at their ages.
That's great. Who wants to go next?
I'll just say something that really stuck out to me was what Samantha said about students feeling that internal peer pressure. So that's something I'll be thinking about. And, how can we maybe build on that, helping kids sort of break that down so that they have the strength to, maybe do something different, not based on that feeling. The other thing is, I think maybe we should have like we talked about, like, behaviors that we don't want to model to our kids. But I think if we're gonna really be if we're gonna be realistic, what does healthy drinking in an adult look like? Can you have a drink once a week? Like what does that look like for someone if we're trying to model, sort of healthy drinking, but if there is such a thing, but maybe not complete abstinence. So that's something else I think that would be worth discussing further.
The thing I keep thinking about is, for the folks who don't want to drink, whether they're in high school or whether they're adults, whether they're at a gala, whether they're trying to go on a date with someone who becomes their future husband, Brian, I mean, do we need to create more safe, like sober spaces? And be in a perfect world, everyone feels comfortable drinking or not drinking in whatever social environment they're in. But I just feel like I've talked to enough people who are like, I'm just going to opt out of that social scene. And so what can we build that feels more like if you're trying to make healthier choices and not use substances and you still want to have a party or have a good time, this is the place for you. Anyone else? No, we don't have to go around the room, but like any final words from anyone?
Yeah, so I think the big takeaway for me is really about education and to understand that if we're talking about it and not keeping it a secret and understanding that there are a lot of resources in the Westport community for education about alcohol use or misuse. And I agree with you, Margaret. I think there really should be a place where teens especially, can go and feel safe and included as opposed to excluded from those parties and the house parties that Kevin was talking about. I think it's really important to feel safe in an environment and not feel the peer pressure that a lot of teens do feel when it comes to using alcohol or other drugs or anything. So I think education, yeah. Thank you.
And I think to both your points, yeah, I would encourage parents, one, to have those conversations, and I like to go back to a message that Jennifer Wallace brought, and it doesn't have to be a long lecture. You aim for having 100 1-minute conversations with your kid. Look for those opportunities to to talk about values, talk about a few things. And also, find your group and find your community. There are a lot of people that kind of share this thinking, and there's strength in numbers. And on the education piece, just know that there are a lot of resources and a lot of things available to help parents with those conversation starters, with finding information, finding stats, other resources, recovery, prevention efforts, finding communities. I think that the work that Brian has done with Westport Pride has made such a huge difference for people here in Westport just over these few short years. So I think the more people can feel like they're just not alone in anything, and certainly not alone in these conversations, and it's beneficial.
I'll just add three things I think and I appreciate that, Kevin, a lot. From the LGBTQ community, to parents, I would say, check on your kids. They're, we're not all right now, just given the environment we're all in. And I think those numbers I quoted are probably, I think if we look back in a couple more years, they'll probably increase during this period. So education, conversation, and there's a book, The Velvet Rage. We had the Alan Downs speak here over the summer, and it's a really great book for talking about some of these things and learning about minority groups within the queer community.
And for anyone listening in to a recording, I would say everything that has been said is so amazing. If you're looking for more education, if you're looking for more affinity space, they both come in the form of the Westport Prevention Coalition meetings, right? And we try to make the meetings, we shift the times around so that more people can attend, but they don't cost anything to attend. I think to me, it's like, wow, this is amazing. So anyone wanting to learn more, just drop into one of the meetings that are held online most of the time. And then sometimes we do kind of like a show and tell one, which we did last month, I guess. Right.
Right.
Yeah, that's it.
Awesome. I think, Sam, did you have any final words that you want to share? You're muted.
I think I've spoken enough during this panel, but thank you guys for inviting me to speak.
Oh my gosh, Sam, thank you. And TAG is usually at the meetings as well, so they're represented, and we're so thankful and to have their perspective. Thank you so much, Sam, for tonight.
And I think they're here watching, right, Sam? So that's great. So for anybody who's watching, and Kevin made reference to different resources, we'll post this video along with resources on the Positive Directions website probably tomorrow, and we will share it out to everybody here. We can all share it through our own social media and websites. We'll have the recording and hope to spread it around. But what an interesting conversation. I love just all the different perspectives. And thank you all for being so open, for giving up your time, for being amazing people, for being part of the Westport Prevention Coalition. This was great. Thank you so much.